Welcome back, guys, to our COPD education series. We've talked a little bit about COPD in one of the last videos and kind of talked about the diseases that fall under, but in this video we're going to talk specifically about a breathing pattern that can help quite a bit if you're having a COPD exacerbation. Now, exacerbation, nice medical term. All it means is a flare-up. So we're having a flare-up, or your breathing will get harder over a short period of time. So we know that COPD is a chronic, which is what the C stands for, disease. So over a long period of time you have this disease. So a flare-up or an exacerbation is something causes your breathing to get shorter quickly. So your breathing gets shorter quickly and you're having an exacerbation. So today we're going to talk about pursed lip breathing. So pursed lip breathing is a technique that's used for patients with any type of COPD and they're an exacerbation. And what it does, it specifically causes back pressure into the airways. Now you might wonder why do I want to cause back pressure into the airways? Well, because if you remember from before, you have weakened airways right here above your alveoli, above your air sacs. So it's really important that if I cause back pressure, or when I go to exhale, pursed lip breathing looks just like this. Almost like I'm whistling or I'm blowing out a candle. So as I do that, as I exhale, you know, there's resistance, you're causing specific resistance, or you're impeding the flow coming out, and you're putting it through a small hole between your lips there. So the interesting thing is that when you do that, you cause pressure to kind of push back into your lungs. That pressure goes back here, and remember those weak airways on this side, it actually helps to splint them open so they don't collapse when you exhale. So pursed lip breathing is something to do that works really well during a flare-up. You take a breath in to smell the roses, and out to blow out the candles. And that's the best way to think of it when you feel short of breath, because that is using your mouth, using your system to care for the problem that may be going on lower down. With a type of COPD, especially emphysema, if you just get short of breath and go, what's happening with that case? You see that's in and out of my mouth very quickly. These airways are closing off each time, and you're never actually getting rid of the waste gas or the CO2 that's kind of in your alveoli. So then you get more short of breath. Breathing in the nose, smelling the roses, and blowing out the candles really uses that back pressure to splint these open so that the air can totally get out each time. So your CO2 gets out of your airways. So shorter breath is something you have to consciously do, and you have to really practice it. But to get shorter breath instead of out like a lot of people do, you should breathe much more like this. And so this is something you have to consciously do. In your nose, out your mouth. Pursed lips, causing the back pressure and having a long exhalation. So the longer the exhalation is, the more effective the breath is. Now, you may be really short of breath, and you maybe it's something like that. But if you can exhale or blow out for a long time, that's so much better for you getting past the exacerbation. So pursed lips look something like this. You notice how long I exhaled? Like I said, the longer you exhale, the more CO2 you can get out, and the faster you'll turn around the exacerbation or the flare-up that you have. So pursed lip breathing, it's a great technique. You need to practice it because it's something that you can even practice when you're not having a flare-up, so that when you do, you can go right to that place where you can do that. Smell the roses, blow out the candles, and act like you're blowing out a ton of candles. Let's just all over the place, because the longer you exhale through those pursed lips, the more CO2 you can get out. I hope this was a helpful tip. Make sure you practice it before you have to use it during a flare-up. Thanks.